Hello, good morning, Dhanalakshmi. Good morning, Dr. Nigel.
Good
So
morning. Good
nice to
morning,
see you,
Shiva.
both of you, on Saturday morning. Doctor, we want to congratulate you for being the first doctor on our series of Ask Your Doctor series that we are
It's a
starting
pleasure.
in this April. Yeah, so
It's a
because
pleasure to be.
April being the PD month,
Yes.
and neurosurgeons and neurologists being much in demand in terms of answering questions and fielding
Yes.
queries on Parkinson's, I thought we'll best start with you, given that we have lot of members consulting at Global Hospital where you consult. Doctor, first we would like to know a little bit background about you. Can you tell us your specialty and what do you do at Global, and what is your focus on Parkinson's at Global?
So I am basically from Bangalore, but I'm now settled in Chennai from 1999. I did my neurosurgical training at the Voluntary Health Service Center. And since then, I've stayed on in Chennai. I have done 4 years of fellowship in Australia. At that time, I trained a lot in deep brain stimulation for Parkinson's, and that's become one of my areas of interest currently. We've done quite a few cases here since I returned, and the results have been good. We have a very strong movement disorder team comprising of a functional neurologist, myself as a neurosurgeon, and then we have a consultant psychiatrist, a neuropsychologist, we have a anesthetist, and we have a whole backup team of physiotherapists, and we have a clinical practitioner also who helps take care of the patients.
That's
So,
excellent. Doctor, do you
yes,
want to tell a little bit about the new center that you have at Global for people with PD?
yes. So, seeing the need for this, we've been able to set up a comprehensive, integrated Parkinson's disease clinic, and we're going to allot one day in the week,
Mhm.
where we will only see patients with these movement disorders and Parkinson's. So that was launched just 2 days back, and we it was a success, I think,
Yes.
and we have included a number of programs and schemes, for Parkinson's, including for the caregiver also.
Excellent.
The caregivers who play a major role in the lives of patients with Parkinson's. So we have included a package for them also, where we will, you know, do some tests for them and see how their health is. And yeah, so things are looking good and bright, and
Great.
hopefully that we'll be able to take this forward together.
Absolutely. Absolutely. And a center like that in a hospital setting is very important because
Yes,
I'm sure you have a lot of footfall of people with PD coming in there at Global.
yes,
So, in one stop shop, if they can avail all the supportive care that they need, counseling,
exactly.
physio,
Physio.
counseling for the caregiver, occupational therapy, speech therapy, it's amazing. So, please continue your good work. We have what
Thank
we
you.
have done. Thank you, doctor. So, what we have done today is we have asked some of our members to send in their questions. Um, some are related to DBS, some are not. So they have just asked whatever is like, I think, most significant issue for them. I mean, I will leave it up to you to figure out the relevance of it and answer accordingly. So
Sure.
one member of ours is asking uh, that he takes Sindopa Plus regularly 4 to 5 times a day. Um, Okay, this is okay. I'll read out the question because when I wish to visit a social function, someone visits me at home to be comfortable and interact with them. I take an extra dose. So he takes 4 or 5 times a day. But when he needs to be out and about socially, he just pops in another Sindopa, looks like. So I want to increase the dosage to enable to be on my on period and feel comfortable. So because he's randomly like as need basis increasing the Sindopa intake whenever he wants. He's saying, will this have any side effects?
Yeah. See, now increasing the dosage and taking an extra dose of, I think he should consult his neurologist that he is going to be doing that. Now, having said that, see, this Syndopa, if you take an increased dose, it may have side effects. We know that Syndopa in larger doses, they may have some adverse effect rather than a beneficial effect. And his tablets need to be taken specifically at a time spaced out so that he doesn't go, he doesn't have more of an off phenomenon rather than. Now, there are other medications also which have a more rapid onset of action. Some of the other agonists, the dopamine agonists, which act quicker than the Syndopa. Now, having said that, if he is not having any adverse effect from taking that extra tablet, and if he's able to manage, and if it is not causing him a problem, and if his neurologist is okay with it and is aware, then I think he can just take that extra tablet,
Okay.
provided it is not causing him any side effect.
Okay. Okay.
But if it is required very often, he may want to consult his doctor and add on an agonist which has got a faster onset of action.
Understood. Understood. So just to summarize what doctor is saying, if it is like a once in a while occurrence that he's taking an extra Syndopa, it's okay.
It's
but
okay. Yeah.
but it's not like it's only Syndopa has to be taken for a fast acting on time. There are a lot of dopamine agonists that can be taken also. So consult your doctor if it is happening at a very frequent basis, is what you're saying. Thanks, doctor. He also has another question. He's saying, I also have thyroid and he's taking Syndopa on an empty stomach. So can I take Syndopa before I take the thyroid medicine? Is that okay?
Yeah, I think that should be okay.
That's not an issue, right?
That's not an issue.
Syndopa. Okay. Thanks, doctor. There was another question. How much Syndopa can one person take? Like this gentleman is taking 110 mg.
Yes.
I don't know how many mgs he's taking per day, but he's saying of 110 mg, how much is like a maximum dose? Can we take 5 or 6 dosage of it?
See, there are some patients I've seen who have been taking 5 to 6 tablets, but they were having adverse effects. They will develop dyskinesias, and they will develop some painful motor dystonic movements. But mostly dyskinesias when you reach that level of dosage.
Yeah. So also, I think you would agree that it also depends on the person.
Yes.
It's very individual.
Each person it's very individual.
Yeah. So there is no one set. So you're saying typically when they're going to that level, then there can be dyskinesia.
There can be side effects from the medication.
Right. Okay. Also, he's having numbness and curling of his toes.
Yes.
Even after exercise and day-to-day activities at home. The effects are still there. There's still the curling and the numbness. What can be done to get over?
So that is the dyskinesia. If it is involuntary, this curling of the toes, this is like a type of a dyskinetic movement which he is developing. Is he the one who's taking 5 to 6 tablets? Is he taking 5 to 6 tablets?
He has not written his dosage, but he has said, can one person take so much? Is what his question was.
Sorry, I missed that last part.
He didn't mention how much he is taking.
Okay.
He said, can a person take so much?
Yes, provided they are not having any side effects from the medication. Usually when you're taking 5 to 6, you're bound to develop some side effect. But it varies from each person to person. Now, if those twisting of the toes, that is a type of a dyskinetic movement which he may be developing.
Oh, is that part of dyskinesia?
Yes.
Could that be because of the medicine or because of the
Yes, because we had one patient who was having those dyskinetic movements in the foot only, and he was not able to press the clutch, and it would suddenly start, and he was having a problem driving. And we advised him to switch over to a automatic.
Okay.
Yes.
So maybe some medication adjustments can help.
Exactly. So those movements may be the early onset of his dyskinesia.
Oh, I didn't know this, doctor. Good to know this.
Yes.
I just
Yes.
thought it's another symptom of Parkinson's, and most people tend to have that.
Yes.
Okay, that was a good clarification. Let me see. Okay, how bad or okay is it to abruptly stop taking Syndopa or any sort of levodopa? What happens? Um, if there is a compulsion to discontinue, somebody is taking it and wants to discontinue, what is the best way to do it?
No, it has to be slowly. You cannot abruptly stop any medication. It has to be gradually tapered, and a new medication has to be introduced, and then it can be. So it is. I think it's better not to abruptly stop the Syndopa. They may have worsening of their symptoms if you abruptly stop it.
Exactly. So it's best not to stop it abruptly. Gradual reduction is a good
It has
idea.
to be a gradual reduction.
Okay. I want to just apologize to everybody listening to this about the construction work that's happening next to my house.
It's not much of disturbance here, but yes, you can faintly hear.
Extraordinarily bothersome in my head. One second, I'm going to mute myself so you don't hear it. Doctor, we have some questions specifically for DBS.
Sure.
Um, yeah. So, are there any alternative treatments that can produce the same results as DBS?
Alternative treatment. See, there is an apomorphine pump which has come out. Whether it gives you the same result, I'm not sure because we don't have anything comparing them. But yes, because see, this apomorphine, there is an infusion pump or even intermittent injections of this apomorphine pen, which has got a apomorphine is a rapid onset agonist of dopamine, and it has got a more, acts faster, but the duration of action is less than the Syndopa. So once you take a shot of apomorphine, or if you're getting it via a pump, it will act faster. The onset will be faster within a few minutes, but the duration is less than Syndopa. Whether that is going to replace or give you the same effect as deep brain stimulation, I'm not sure about that. But yes, people can try that. It's worth trying.
Thanks, doctor. So I think from what you are saying, and generally from what we have been reading and hearing from others, is that it is mostly a rescue medicine. Uh,
Yes.
like
Yes.
exactly like what the other person was asking, if I need to perform socially or go somewhere and he's taking extra dosage of Syndopa because it works for
Yes.
him. I think
Yes.
some would, if Syndopa doesn't work sufficiently, then some would take apomorphine injection.
Apomorphine.
But
Yes.
as you rightly said, the duration of on time or the hours it would work well is
Is
much
less. Is
lesser
less.
than Syndopa.
Absolutely.
So
Yes.
it's not a lasting, permanent,
No. No.
kind of permanent, quote unquote permanent like DBS. So there is
No.
really no alternative to DBS yet. Is what
DBS is a lot
the
different. I
surgical
know.
procedure. So
Yes.
there's no alternative to that. Also, another question, the same person, how much is the life expectancy after DBS?
The life expectancy of the person or the life expectancy of
I
the
think they
person?
meant the person. I think they meant.
No. See the life expectancy is good. It all depends on each individual. I don't think after DBS that's going to reduce your life expectancy. It's not.
Yeah. So I
So
think what they want to maybe know is how long will they continue to live well maybe after DBS?
as long as you don't have any other comorbidities, like any heart condition, diabetes, hypertension, which is going to cut short your, then I think you should have the norm. You should have the life expectancy of any other like any other person who doesn't have any comorbidities. DBS will not reduce your life expectancy, but Parkinson's disease, as we know, is a progressive disorder. So the disease may continue to progress, but it will not cut down. DBS will not reduce your life expectancy.
Yes, that's right. I think maybe what they wanted to know was, will it increase the life expectancy? Um, I think DBS would increase the quality of life.
Quality of life, very
And
much.
decrease the progression of Parkinson's. Hence,
Yes.
that way they can go. In fact, it might add to a comfortable living. And as you rightly said, there are so many other factors, comorbidities, and not just Parkinson's. In fact, a lot of doctors go on to say that Parkinson's is not a fatal disorder or a disease like cancer. Because of that, you develop other problems and hence.
So one more thing, as you rightly mentioned, that see, there are some reports where they say that DBS also slows down the progression of Parkinson's, what you mentioned. Yes. There are some reports on that.
I think this question is, are these surgeries done in India? Are these DBS surgeries done in India? Who are the doctors? Dr. Nigel himself is doing these surgeries.
Is doing that. Yes, there are more and more centers who are doing all over India, Deep Brain Stimulation. See, it's been around for around 30 years now. It's just that more and more doctors are getting trained, more and more neurologists are getting trained, more and more centers are acquiring the equipment, as we know that it requires a lot of equipment, costly equipment, but it is being done in every major city in India now. DBS is being done. So that's that.
So DBS is being done in India. A lot of centers are there.
A lot of centers, yes.
Majorly in the big metropolitan cities and also in smaller,
even
tier
in the
1, tier 2 cities also sometimes this happens.
Yes, they're doing DBS in Trichy,
Coimbatore.
Yeah.
Doctor, more basic questions on DBS. Does DBS surgery produce dopamine?
No, DBS surgery does not produce dopamine.
Okay.
See, DBS only, it's like I said, it's like a pacemaker. Once you on the battery, those electric stimulation are going to jam the abnormal circuits. So once you switch off the battery, or if the battery dies, or if you don't charge it, or the battery switched off, all your symptoms of DBS, all your symptoms of Parkinson's is going to resurface immediately. So DBS, it's not a cure for Parkinson's. It does not produce dopamine. It is only an electric stimulation which hijacks the abnormal signals in the brain, allowing the normal signals to surface. It does not produce dopamine.
Doctor, this is a very good point. Maybe you can elaborate a bit more on this. So, lack of dopamine causes Parkinson's disorder. General medication is that which gives dopamine artificially through pills to the body. So, the repetitive question might be, so how does DBS help? Can you exactly explain a little bit more in detail? What exactly is DBS doing that it is helping people with PD?
Yeah. So, deep brain stimulation, there are two nuclei in the brain. One is the subthalamic nucleus, or called the STN, and the other is the GPI, or the globus pallidus internis. These are the two most frequently used nuclei for DBS for Parkinson's. So we know that Parkinson's, there's a depletion of dopamine in the basal ganglia. Because of that, there are a lot of aberrant or abnormal signals in and around the basal ganglia. And the basal ganglia is responsible for the initiation and execution of movements. So once this dopamine is depleted, all these circuits, they start functioning abnormally. And the initiation and execution of movements, all the stiffness, rigidity, bradykinesia, patients start developing these symptoms. So in DBS, we are placing under a very precise technology where we use all the navigation and the frame to insert an electrode, either mostly we insert it into the STM, sometimes even into the GPI. And it is connected by electrodes to a battery. And once we on the battery, this electrical stimulation, it blocks the abnormal signals in the brain, in the basal ganglia, allowing the normal signals to start functioning. So we are basically blocking all the abnormal signals in the brain, in the basal ganglia.
I think that was the key that they would maybe look for. It's stopping the abnormal keys,
Yes.
abnormal signals that's going on.
Yes.
Because if there was enough dopamine, there will be a clear signal between the neurotransmitters. Lack of that, there is a cross wiring. So with the electrodes that you place and the current that passes through them, all these abnormal signals are much reduced.
Much reduced.
Much reduced. Okay, great. So following the same question, can you do normal activities after the surgery?
Sorry, I did get that.
Can you do normal activities after the surgery?
Yes, you can. Your quality of life, as you must have seen, is dramatically changed. You'll be doing all your independent activities. As some of our patients say, they go back to having a haircut, root canal treatment. One gentleman also continued his martial arts. Another one is riding a two-wheeler. So your quality of life improves dramatically.
Exactly.
It's a dramatic turnaround.
Yeah. Also, are there any do's and don'ts after the surgery? Are there some things that they're not supposed to do? Or there's some things they're supposed to do to maintain their health or well-being just because they've had DBS?
Yes. See, one is if you have a rechargeable battery, you've got to do. I'm saying the do's. The do's are, frequently and recharge your battery so that it doesn't die down. Otherwise, they can lead a normal life. They can go back to leading. There are very few don'ts. I don't see any. You can't do this because you have a. It does not prevent you from having any surgeries. It does not prevent you from having an MRI, or it does not cause any alarms to go off if you're in the airport. So, people are worried about all these. So it's there are very few don'ts actually. You can go back to leading a relatively normal life, what you were doing before DBS.
Doctor, so you said something in terms of do's. You have to recharge your battery frequently. Is that what you said?
Yes. You get a charger. If you have a rechargeable battery, you will get a charger which you have to place over that, and you need to recharge. You need to recharge your battery depending on the usage, and it will give you a signal, when it's wearing down, and then you just got to charge your battery.
Okay.
You can drive also, because see, most of the times we put the battery on the left side. So one of the reasons is that you can wear your seat belt. So the seat belt comes over the right, so it doesn't. If the battery was on the right side, then it would be compressing, the seat belt would compress. So we always look at that side if the patient is driving, so that they can even continue to drive even after DBS.
Oh, I never thought of that seatbelt aspect.
Yeah.
Okay, that's good to know. Also, are there any side effects after DBS?
Side effects, see, sometimes when we on the battery, they may have a little bit of anxiety, sometimes a bit of depression, confusion, and this is in relation to the stimulation, what the frequency and the pulse with the stimulation. So sometimes even they may become a little depressed and confused. So these are all very minor issues, and they can be handled. Their speech, they may become a little dysarthric. So these are some of the side effects of the stimulation. The complications of the surgery are around 2 to 3%. And that is related to the surgery, which is around 2 to 3%. But the side effect is when you're on the battery, they may have these minor changes, which can always be dealt with.
Okay. Okay, from what you're saying that the surgical procedure itself, yes, it does carry some risks, but that's
Two
again
to
very
three percent.
minimal.
Yes. It's
And then if the once the surgery, the surgical part of it is successful and you turn the battery on, there might be some unexpected symptoms, like you
yes.
said, depression
Like
or speech, but they can all be addressed to other therapies or counseling, or they
yes.
can be
And
addressed.
even by tweaking the battery, you go back to
Hmm.
your neurologist and then you tell them you're having this, and then the settings and the battery may be tweaked
Okay,
to get the best result.
okay, fair enough. What is the success rate in BPs in India, from what you
Yeah.
have said?
The success is going to be, it's got a very high. I can't put a figure on that. Because all our patients we have done have all been successful. The procedure itself is been successful, and there are few patients, yes, who don't really benefit as much as others. They just benefit less than what others would benefit. But then that again can be dealt with by again tweaking the battery and increasing probably the amplitude and so I would say the success is around 95%. It would be
I
around
think your
90.
figures are mostly from your own personal experience of how well it
Yes.
has gone with your team, right? Yes,
So
absolutely.
we are yeah, it's around 95% success.
Okay, okay. Um, um, Although these questions aren't directly asked, but they usually come up in our other sessions. When you have the time, doctor, when we finish the session, can you maybe send one of us a video of pre-operation and post-operation video of any, with
Patients.
consent, of course, of the
Sure,
person?
definitely. Yes, we
Something
can.
that we will not put it in the public forum or share it also on our WhatsApp. Only if they
Yes.
ask, we can, share it on an individual basis and ensure that, they don't pass on that video to anybody. So something
No,
like
that will be very useful
that.
for other patients who are waiting, because when they see the dramatic turnaround, that will motivate them also
Exactly.
to go ahead if they have decided.
Yes.
Because some of the patients have been wheelchair bound, and today they are walking and riding a two-wheeler also. So I think we should. I will send you
Yeah. Okay.
some
Okay.
videos of
One
our
video,
patients.
or
Yeah.
yeah, a couple would be very useful, doctor. Um, a few other things that they ask generally is okay. Also, the cost of DBS. How much would it cost?
Yes. See, here in our hospital, the package is. It depends again whether you go for a rechargeable battery or a non-rechargeable battery. So the price difference between the two batteries is around 4 lakhs, I think. So for a rechargeable and a non-rechargeable. So what our hospital, we have a package. It is, I'll say it's approximately around the 15 lakh mark for a rechargeable battery. The difference the patient should know is that a rechargeable battery lasts for around 15 years depending on the usage. Now, for a non-rechargeable battery, which lasts for around 5 years, the package will be around 11 to 11.5 lakhs. So there is a good 4 lakh difference between the two.
Doctor, if I understood correctly, you said that non-rechargeable batteries last for 5 years.
5 years.
So
You
they'll
don't have
have
to
to do
charge.
another. They'll have to do another surgery to insert it, right?
Yes, only the battery. We change
Only the
only the
battery
battery.
here. The
You
base.
don't need to touch the electrodes or the wires.
Exactly, exactly.
So you
And
need
how much
to,
would that cost just to replace the battery?
yes.
How much would
So
that cost?
I'm the battery, it would be around 5 lakhs,
Five
including
lakhs.
the hospital package, everything.
Okay. Okay.
Everything it will include.
So if you look at the cost benefit of it, if you use a rechargeable battery, although it's expensive to do it at the first go, you will not have to go through a surgery again, and you'll not have to spend anyway at 5 lakhs again, which will be
Yes,
included in the beginning itself.
yes,
So maybe in that
yes.
way, and it lasts for 15 years, as you
15
say,
years, 15
at
years,
least,
the
depending
battery,
on
at
usage.
least 15 years. Yes.
Right. Um, Dana, do you have any questions to ask?
No, Sudha.
No? Okay. Doctor, are there any dramatic, I know we spoke about side effects, in terms of emotional side effects that you have seen after
Yes.
DBS, that could be something that members have to,
Yes, that can happen.
that's
See,
the
they become
mood.
they have some mood changes when you're on the battery, and they may become a little anxious, depression. It may be either. So yeah, those issues.
Is there somebody you would consider who is not an ideal candidate for DBS? Is there somebody?
Not an ideal candidate.
Mhm.
So I'll tell you first the criteria we look for
Yeah.
when we are selecting patients, and I'll tell you after that those who are not. So most important is that the patient's Parkinson's disease should be responsive to levodopa, that is syndopa. So if the patient doesn't respond to syndopa or levodopa, then they are not candidates for DBS. So they should be a levodopa sensitive or responsive to type of a Parkinson's disease. Then they should have complications from syndopa, what is called as the dyskinesias or painful dystonias. They should have the disease now, they say, for a minimum of 4 years. So anybody with Parkinson's who's 3 years, 2 years, we wouldn't be recommending. So minimum, what they say now is 4 years. They should have motor complications or motor side effects for at least 4 months. They should not have any severe comorbidities, like hypertension, which is uncontrolled, diabetes. They should not be any heart patient. They should not. So the comorbidities should be less. So somebody who is at a very high risk, we wouldn't recommend. Then those who do not fit in, they may have some, Parkinson plus Parkinson's, the supranuclear palsies. These kind of patients we wouldn't recommend. Patients who are depressed, who have, psychiatric illnesses. These are the kind of patients who will not fit in. Those who are very old. There's really no age limit as long as the patient is fit. There's no age limit, but above the age of 18 years, and usually they say below 65, 70. But then if the patient is fit and well, so age is just a number. But somebody who's very old with a lot of comorbidities, we would not be recommending them to have deep brain stimulation, and they should not have any of the supranuclear palsies or the Parkinson plus, and they have to be responsive to levodopa.
Right, understood. So there is a screening process involved, and
Yes.
not everybody with Parkinson's would be eligible for DBS.
No. It's very, very
Very,
strict guidelines for selecting
yeah.
candidates. Then only the results are good. If you don't select the correct patient, the results are not good, and the patient's
And
not
then when they
happy.
ask for a success rate, then it will look very
Yes,
abysmal, and then they'll be like,
absolutely.
oh, maybe DBS itself doesn't work. But how you choose a person for DBS matters.
Matters. Yes.
Yeah. Um, there was a question I was thinking I should ask you, and I suddenly slipped. Wait, let me see if there is any other question. I guess that's about it, doctor, for now. Anything else you would like to add on DBS that we have not covered so far?
Uh, I would like to say that it's a safe. It's the risks are not very high, and people should not fear that putting electrodes into my brain. Come and have a meeting here. You speak to us, and of course, it's a process. It's a process which we have to go through with the patient, the caregivers. It's not a one-time consultation where you decide about, I'm going to have. It's multiple visits with your family. Who's going to look after you after that? You need a lot of family support.
Yeah, true.
You
Doctor,
need a lot of.
I suddenly remembered what I wanted to ask you. Do you think it is more
appropriate for somebody who is diagnosed with a young onset of PD would be a better candidate or more eligible for DBS? Like if you're diagnosed in your late 40s or early 40s, and by the time you're in your 50s, early 50s, would that be a good time to do DBS?
Yes, see, age, now we are getting more and more patients who are getting this problem at an earlier age. So they're always, they're always good candidates to have the surgery early rather than late. But the minimum period is still 4 years before we see. Before in the past, previously, they used to wait for 10 years, 11 years, 12 years. We don't wait that long anymore before advising a patient to have deep brain stimulation, because by that time most of the is already died out. So 4 years after they are diagnosed, irrespective of whether they are 45 or 50, but earlier it is done now after 4 years, they have a good result.
Okay, that's I think a very key point. Even if
Yes,
somebody is say diagnosed at the age of 44 or 45,
yes,
by that don't wait till you're 58 or 60 to do the
yeah,
DBS.
exactly,
Do it
exactly,
within the 5 years. Actually, that's like almost a golden period of PD when the symptoms
exactly.
haven't manifested too much. So you're thinking, oh, I'm all right. Why should I go in for such a risky, expensive procedure? But if you do it at an earlier stage, that quality of life will continue for another 15 years,
Yes,
as against a
that is,
rapid deterioration later.
yes,
Right? Yeah. So I think it's very key that we say this, and I'm happy you mentioned because a lot of our members are in that bracket. As you
yes,
said, we are seeing a lot of cases in late 40s or early 50s.
yes,
So I think for that, this will be very helpful. This was
yes,
really informative, doctor, about DBS. Thank you so much. And I think the more we talk, the better,
absolutely,
because the issue is such, I think it keeps coming up every so often.
yes. And congratulations and for all the work you're doing, and with the Parivarthan group, and really you're doing a wonderful job. And I think all the Parkinson's patients should be happy to have you. And I think we should continue and spread the awareness. And from our side, whatever possible way we can help, you can be sure you can count us in.
Absolutely a pleasure, doctor. Really, thank you so much for spending this time with us
Not a
today.
problem. Pleasure is mine. And
Yes,
thank you
so
for
ours
inviting me.
too. Thank you so much. Very helpful. We will share this video. Just hold on. I will turn the live off, but you can stay.